respected audience, Assalamu alaikum. I am Professor Shamsuzzaman, Professor of Pathology. I welcome all in today's 37th lecture on systemic pathology. Today, day 7 of diseases of cardiovascular system. Day 7 of diseases of cardiovascular system. Today's topic is heart failure and pro-BNP. Today's topic, heart failure and pro-BNP. Heart failure and pro-BNP. First come to what we mean about heart failure briefly. Heart failure is a chronic progressive condition of heart. A chronic progressive condition of heart in which heart muscle is unable to pump enough blood to meet body's need for oxygen and blood is known as heart failure. Again, it is a chronic progressive condition of heart in which heart muscle is unable to pump enough blood to meet body's need for oxygen and blood is known as heart failure. Dear audience, you know, if this is the heart, it pumps blood comes out of the left ventricle and it circulates throughout the body. Again, blood comes in the right atrium, then to right ventricle, and it goes to lung. It is purified and comes in left atrium, then to left ventricle, and again left ventricle pumps blood. If heart muscle become unable to pump enough blood to meet body's need for oxygen and blood, then it is known as heart failure, and it is a chronic condition and it is a progressive condition. Sometimes heart failure is known as congestive cardiac failure. Sometimes heart failure is known as congestive cardiac failure, CCF. Dear audience, if the heart muscle cannot pump enough blood, then there will be decreased cardiac output. Ultimately, there will be decreased venous return, and due to decreased venous return, there will be increased volume of blood in the tissue. There will be increased volume of blood in the lung, and there will be congestion. Sometimes heart failure is known as congestive cardiac failure. There are some conditions that are associated with congestive cardiac failure. Conditions associated with congestive cardiac failure like coronary arterial disease, coronary arterial disease like coronary narrowing, coronary narrowing. Another condition associated with heart failure or congestive cardiac failure, high blood pressure. So, coronary arterial disease like coronary narrowing, high blood pressure, these are associated with congestive cardiac failure, associated with heart failure. This is briefly heart failure. Now come to pro-BNP. What is pro-BNP? Pro-BNP is a peptide. It is a peptide. It is known as pro-beta natriuretic peptide. It is pro-B-type natriuretic N peptide. P. So pro-BNP, it is a peptide. It is pro-B-type natriuretic peptide. Now come to source of pro-BNP. Source of pro-BNP, one is left ventricle, another one is brain. So left ventricle of heart and brain are the sources of pro-BNP. Dear audience, pro-BNP is present in blood. Pro-BNP is present in blood. Maximum pro-BNP is produced by left ventricle and minimum is produced by brain. Maximum pro-BNP is produced by left ventricle and minimum by brain. Pro-BNP was first found in brain. Pro-BNP was first found in brain. As it was first found in brain, such natriuretic peptide is known as B-natriuretic peptide. B is the first letter of brain. As it was first found in brain, this natriuretic peptide NP is known as pro-BNP. Here B is the first letter of brain. Dear audience, again, as it was first found in brain, this natriuretic peptide NP is known as pro-BNP. Here B is the first letter of brain. Along with pro-BNP, another peptide is found in blood that is produced from atrium. Another peptide similar to pro-BNP is produced by atrium, known as ANP. ANP stands for atrial natriuretic peptide. Dear audience, now come to role of pro-BNP. Pro-BNP is associated with absorption of sodium and water. Absorption of sodium and water. As there is absorption of sodium and water, with the help of pro-BNP, there is maintenance of blood volume. Maintenance of blood volume. As there is maintenance of blood volume following absorption of sodium and water, with the help of pro-BNP, there will be maintenance of blood pressure. Maintenance of blood pressure. So, pro-BNP is associated with maintenance of blood pressure. Now come to metabolism of pro-BNP. Metabolism of pro-BNP. How pro-BNP is metabolized in our body? An enzyme known as choline. This choline enzyme splits pro-BNP. Enzyme choline splits pro-BNP into active hormone BNP and anti-BNP. Anti-BNP means N-terminal BNP. N-terminal BNP. So, enzyme choline splits pro-BNP into active hormone BNP and anti-BNP, that is N-terminal BNP. There is half-life of active hormone BNP and anti-BNP. The half-life of anti-BNP is more than active hormone BNP. Half-life of anti-BNP is more than half-life of active BNP. Dear audience, we are talking about heart failure and pro-BNP. we have told heart failure is a chronic condition, is a progressive condition in which heart muscle is unable to pump enough blood to meet the need of body for oxygen and blood. Sometimes it is known as congestive cardiac failure. Following heart failure, there will be congestion. Certain conditions associated with this heart failure: coronary artery narrowing, blood pressure. Pro-BNP means pro-B-type natriuretic peptide. It is produced from the left ventricle and brain also. It is called pro-BNP. B is the first letter of brain because it was first found in brain. Similar to this peptide, another peptide is produced from the atrium, left atrium. It is known as ANP, atrial natriuretic peptide. This pro-BNP is associated with absorption of sodium and water and maintenance of blood pressure. It is split by choline into active hormone BNP and anti-BNP, N-terminal BNP. Half-life of anti-BNP is more than the half-life of active BNP. Now come to heart failure and pro-BNP. Dear audience, again we recapitulate. Pro-BNP is mainly produced from the left ventricle. So, if heart is in a stressful condition or if there is heart failure, the production of pro-BNP is increased. So, blood level of pro-BNP will be increased. When heart is in a stressful condition, or when there is heart failure, there will be increased production of pro-BNP. So there is increased production of pro-BNP following a stressful condition of heart or following heart failure. As you know, with the help of enzyme choline, it is split to active hormone BNP and anti-BNP. And you also know the half-life of anti-BNP is more than the active BNP. So at the same time, there will be increased level of anti-BNP. So anybody with a stressful condition of heart, anybody with heart failure, there will be increased level of pro-BNP in blood, increased level of anti-BNP in blood. This is heart failure and pro-BNP. Dear audience, this is all about the heart failure and pro-BNP briefly. Good after this, thanks all.